Hey everyone, good day to all. This is our part 3 of our 150 plus topic discussion series, and myself, Dr. Ajay Moria. So, guys, okay, so let's start the session. So, for the PDF, guys, please the link in the description. Okay, just you can get it from there. Otherwise, you can just search Fmge Aspirin at Ajay Moria in the Telegram and get it there. Okay, so let's start the topic here, guys, without wasting our any time. Okay, huh? Good. So, okay, wait, okay, done. So, guys, let's talk about the types of hemorrhages. Okay, ba. Okay, now, see, first one is the extradural hemorrhage. It's a extradural hemorrhage and a subdural hemorrhage, and there is a subarachnoid hemorrhage. See, first one is the extradural hemorrhage. What happens here is that there is a collection of what? Collection of blood between dura. See, between dura and the skull bone. That's why see here, it look like a idli shape. What shape, amma? It is a idli shape. Idli shape or lemon shape. See, idli shape. So in the exam, guys, they are just going to give this image. So that's why that's how you have to identify. So for example, they are going to give this image and they will just tell you what is the treatment. It means what? See the craniotomy. So here it is look like a what? This is a concave shape. This is convex, and also it is lemon shape or a banana shape here. Okay, Nara, and idli shape here. It doesn't crosses the suture line. Remember the what is the most common trauma? What is the most common? It is the it is the most common head injury in the young people. It is the most common injury in the young people, and also what is the most common vessel involved is the MMA, middle meningeal artery. Middle meningeal artery. Remember, what are the clinical? This is what is the clinical feature? This is the first one is the lucid interval. What is lucid interval? There is a first loss of consciousness. First loss of consciousness. Then again regain the consciousness. The period between loss of consciousness and again regain consciousness. Okay, consciousness. Okay, consciousness, unconsciousness, consciousness. It's called lucid interval. Okay, what is the inversion choice? It is the NCCT head. Okay, treatment is the burhole keratotomy and the hematoma extraction. Coming to the subdural hematoma, suppose example, they will just give the 70-year-old male 70-year-old male fell in the bathroom. Then you have to remember that it means they are talking about the subdural hematoma. Okay, or else they will just give the history of someone is a boxers. Boxer is fighting and he got some hemorrhage that is called as the subdural hemorrhage. Okay, this is the collection of blood between dura and the arachnoid membrane here. It is what a mite is a sickle shape or crescent shape. The Chandamama. It is Chandamama shape. Chandamama shape. Okay, Nara? So it is injury to what? Injury to the cortical bridging veins here. Okay, but there is no lucid interval here, but lucid interval seen. What question they are asking? They give the history as boxers or bathroom here history. This is a crescent shape injury to cortical bridging veins. Okay, treatment is the anatomy. Remember here, this one is the subarachnoid hemorrhage. See, archana. You see, archana is bathing in blood. Archana means what? Arachnoid means what? These are the when you are going to see this one in the subarachnoid hemorrhage causes blood in is what? Blood in CSF in lumbar puncture. While doing the lumbar puncture, there is a blood in the CSF. See, Archana is bathing in the blood. So, okay, Naba. Then one. See, this is the most common cause is the rupture of berry aneurysm. Rupture of berry aneurysm. Most common site is the circular villus. First of all, how they are going to give the history as there is a thunderclap headache. Oh my goodness, I have the worst headache of my life. Thunderclap my headache, vomiting, red neck, rigidity, like this one. For this one, you have to do what you do, Rana. You have to do, first of all, you have to control the BP to reduce the bleeding, and your target is the should be less than 140 by 90. And drug of choice is the CCB, that is nimodipine. Remember, nimodipine is the drug of choice. Okay, done. Next one, see this one. See this. These are the pediatric milestones. You need to remember from the milestone, guys. They're very easy. See, transfer object is, see, transfer object. It is the 5 to 7. Transfer object, see, transfer sat, transfer for sat, as for sat, it is 7, 5 to 7 months. Remember, when does child will stand without support? See, child will stand for their first birthday, guys. The child for the first birthday, he have to cut the cake. That's why, guys, for the first birthday, that means for the 1 year, the child will stand without any support. Okay, now next one, see here, when child will sit. Okay, sit without support. See, sit with support. See, sit bottom 6, sit 6, sit 6, 6. Okay, this one. Remember, social smile 2 is a 2 months. Okay, na? Remember here, bowel control is up to 4 years. Bladder control to 5 years. Suppose example, how they are going to test you. Suppose example, they says that a 3-year-old child, and brought to the hospital by his mother, and mother is complaining about that, he was passing urine on the bed. But so you have to tell, okay, ma'am, as the age it's only 3 years. Okay, it's ma'am, it's common for that. It's until 5 years it's common. You have to like this. Okay, if more than 5 years, first of all you have to do the first one is the you have to treat the bell and alarm. Is the bell and alarm technique, and if it not recover, you have to give the desmopressin. Okay, now that's called aneurosis Rama. Next is handedness. The handedness. Remember, handedness means child will understood. Okay, whether I am a left or right-hander. When it's going to appear, it is 24 months. But when does the child completely knows that, okay, I am a right-hander? It is 36 months. Okay, na? Cooing 3 months. See, stranger anxiety 6 to 7 months. Remember this, okay? Let's remember, see here, the weight will doubles by 6 months, triples by 1 year, and quadruple birth weight by 2 years. Height increase by 50% in 1 year. What is the average length? Is 50 centimeter. For the head circumference, what is the average? 33 to 35 centimeter. Okay. Remember here, the anterior frontal leg normally closes by 12 to 18 months. Posterior is very earlier, 6 to 8 week only. Remember here, what are normal pediatric values? Respiratory rate 32 60, heart rate 122 160, BP 60 by 40. Actually, we will measure the BP from 3 years. Meconium must be passed within 48 hours. Urine must go by 24 hours. Remember here, the vitamin A doses here for the 6 months to 1 year old child, you have to give 1 lakh international unit. For the 1 year to 6 years, guys, you have to give the 2 lakh international unit. For the less than 6 months, guys, you have to give the 50,000 international unit. Okay, now. Remember here, the physiological short stature, we have two types, familial and the constitutional delay. Familial and the constitutional delay. See, familial what? The familial means parents' height are short. Parents' heights will be short. Okay, na? And the final height of the patient is also short here. Remember, there is a bone age is equal to chronological age. For the constitutional delay, there is a history of the delayed puberty. The final height will be normal. Okay, they'll just give this one as a MCQ. Remember, in the history, you have to identify the either parents' height are short or normal. It depends, heights are short, then you have to mark the answer as familial. Okay, Nara? These are the physiological short stature. Okay? Done. Remember this one, Ra. This is the neonatal resuscitation program. See, remember. By seeing this one, guys, we'll get, oh my God, what is this, Ra? See, it's very simple. See here, see how they are going to test you, how they are going to ask the question from this slide. Okay, now for example, when you are when you are going to do the chest compression, when Ravi, okay, see if the heart rate is still less than 60 beats per minute, then you have to do the Vatama chest compression. This is how they are going to ask the questions. See, first of all, guys, first of all, in the golden minute, you have to do the assess at the birth term or a preterm, good tone or not, if the breathing or crying. You have to assess this one. If the baby, if yes, provide routine care like warm the brain, a warm, clean, clear airway, dry and ongoing evolution. That is the normal thing you are doing in the during the delivery. If not all these, then you have to do the initiate the resuscitation. The the initial step, the first 30 seconds, guys, you have to check the ABC. ABC, airway, breathing, circulation, then thermoregulation. Okay, guys, see here. Why we are going to do this one? Because see, because if there is a failure to clear the airway, can lead to what, ma? Lead to respiratory distress or hypoxia. Then, Amma, what you have to do? Then next step is do the PPV, the positive pressure ventilation. If there is a apnea, there is no the apnea means what? Absent of breath and the gasping or heart rate is less than 100 beats per minute. Then you have to begin the PPV with self-inflating ambu park at a 46 to 60 breaths per minute. Use 21% oxygen per saturation for term infants and 30 to 40 per preterm infant. Reassure after 30 seconds. If the heart rate is more than 100, then you have to continue monitoring. Okay, now, or else if the heart rate is still less than 100, then you have to consider the steps for the Mr. SOPA. What is SOPA? It is a, remember, it is a M for you have to the mask adjustment, R for reposition airway, S for suction, open mouth, and for pressure increase. A for alternative airway, that is the intubation. Why this is important? Because prolonged inadequate ventilation can lead to hypoxic ischemic encephalopathy. That's why you have to do. See, next step is the chest compression. Chest compression. If the heart rate is still 60 beats per minute despite effective PPV, then you have to do the begin the chest compression. Chest compression 3:1. Okay, with ventilator. You have to always use this one, these fingers. Okay, like this. Chest compression. Use thumbs or two fingers. Thumbs or two fingers. Thumbs or two fingers. Technique at 120 events per minute. Okay, now continue for 30 seconds. Why is it important? Because inadequate cardiac output can lead to multiple or multi-organ dysfunction. Remember here, next you have to do the, if it is failed, then you have to do the, give the medications and advanced intervention. That is, if the heart rate remains 60, less than 60 beats per minute despite compression and the PPV guys, then you have to administer what epinephrine. How much epinephrine you have to remember? 0.012, 0.03 mg kg per IV. Okay, Nama? Remember. And also consider volume expansion with the water, normal saline, how much? 10 ml kg per IV. Next, you have to correct the metabolic acidosis with the sodium bicarbonate if needed only. Why this is important? Because delayed resuscitation may increase risk of neonatal mortality and the neurological sequelae. Okay, this is also failed, guys. Then you have to do the post resuscitation care. Monitor for the hypoglycemia, hypothermia, hypoxia, and infection. Admit to the NICU, NICU, newborn, neonatal for observation if resuscitation required. Supportive care includes special support, thermoregulation, and the glucose. Because why it is important? Because to close monitoring prevents secondary complications such as hypoxic injury and sepsis. Okay, this is the step for the neonatal resuscitation. Next one, you have to do the UPGAR score. Okay, I think everyone knows about the UPGAR. A means what, amma? Appearance, or the color, P pulse, grimace, activity, respiration. Remember here, this is not the respiration. This is not the respiratory rate. This is respiration. Either the respiration is regular or irregular. This is not respiratory rate. Okay, na? The most important parameter is the pulse. Okay, remember. So guys, I will let you know about the Apgar in the upcoming lectures. Okay. That's why this next one is the guys the types of the murmurs. Okay, na types of murmurs. Types of murmurs are very important. See here. I'm just telling about the. I will just tell about the for the only exam point of view. Okay, na see only exam point of view precision. How to mark within 1 second you will mark the answer. So okay, na last time they asked about the Austin Flint murmur is the array is the aortic regurgitation. See a patient came to IM department, chief complaint of dyspnea, worsened during physical activity. Patient fainted few hours upon acceleration soft S2 paradoxical split ejection click when AV opens and causes the MS. See, this is the Patama crescendo descendo pattern murmur. That's it. Crescendo descendo pattern murmur they mentioned in the question. Just mark it as that is the aortic stenosis. Okay, see this is how you are going to mark the answer within 1 second. Just see that whether there is a whether there is going whether they mention that murmur or not. Okay, see, this is the ask, that is there. It may lead to syncope, angina, dyspnea, or exertion. Isn't it? There is not which version during physical activity. There is a crescendo descendo pattern murmur, loudest at the heart base and radius to the carotids. It is most common in the more than 60 years old patient, most common due to age-related calcification. And in younger patient, most common due to onset and calcification of bicuspid aortic wall. This is this is the crescendo descendo pattern murmur. Remember this word. Crescendo, crest, S. Okay, na? Next one is the mitral stenosis. Mitral stenosis. See, mitral stenosis, guys. It is the we'll see the descendo. Okay, na? We'll see the descendo pattern. We'll see the descendo pattern murmur best heard at the mitral wall area. Remember here one thing here. Remember it follows opening snap. Okay, opening snap. Okay, see crescendo descendo aortic stenosis, mitral stenosis. There is a mitral stenosis. Yes, mitral stenosis. Yes, snap. Mitral stenosis snap. It is stenosis opening snap, which means delayed rumbling, mild to late murmur. It decreases the interval between the S2 and the OS coded with the severity. Just remember that this is the opening snap. This word will be in the question. You have to mention it. You have to remember this one. Okay. From the mitral or tricuspid regurgitation, remember here there is a blowing. There is a high pitch, holosystolic, high pitched blowing murmur. High pitched blowing murmur. Okay, in the mitral regurgitation, it's loudest at the apex and ready toward the axilla. See, all these words they are going to mention in the question. You just by heart these words. Okay, coming to the tricuspid regurgitation, it loudest at the tricuspid area. Okay, remember here from the aortic regurgitation, guys, it is like a water hammer or collapsing fuel. See pulse, collapsing pulse. PIULSC. Okay, there is a Corrigan sign. There is a Corrigan, the dancing carotid sign. Okay, now, and there is a high SBP but low diastolic blood pressure and soft S2 that called as Austin Flint murmur. Austin Flint murmur. There is a also you see the Quink's pulses. You will see there is a something is you see the pulses movement in at your nails around. Okay, just remember the okay aortic stenosis. Descendo, cinco, mitral stenosis, opening, snap, mitral artery regurgitation. There is a blowing, high pitch blowing mark, high pitch holosystolic, high pitch murmur, aortic regurgitation, Austin Flint murmur, Quincus plus X. That's it, sir. Okay, no need to focus deeply. We need marks. Okay. Next one are this one are these three images. There is having the cardiac tamponade, flail chest, and pneumothorax. Na cardiac tamponade. We'll see. You know there is a waterma. There is a Bextria that is water. Bextria that is hypotension, distended neck, and neck vein. There is a decreased heart sound. Decreased heart sound. This is the Bextria of the watermark cardiac tamponade. Compression of the heart by fluids. Compression of the heart by fluids due to blood or there is a effusion, which decrease the cardiac output and equilibrium of the diastolic pressure in the all chamber. Okay, due to what? Compression of the heart by fluid. If there is a effusion, guys, there is a compression of the heart. That's why there is a hypotension and there is a distance in neck veins and there is a decreased heart sound. Okay, it also follows the pulsus parataxicus. Okay, just remember that treatment with the pericardiocentesis or surgical drainage. Okay, na? ECG shows the low voltage CQRS and electrical alternative to swinging QRS. Okay, Amma, just remember the dextriad, hypotension, distal neck. This is more important. But I think flail chest me there. What happens here? There is a break. There is a 3 or 4 ribs will be fractured in 2 or more places. It follows the paradoxical chest movement. See, paradoxical chest movement. Leg. This is normal. But in the paradoxical chest movement, while we breathe, the air will go inside now. But while we breathe, the air will come outside. Like this is the paradoxical chest movement. Treatment with the pain, the surgery, pain control, oxygen support, and the PPV. So remember the pulse paradoxica, it means there is a systolic BP by what? More than decrease in amplitude of systolic BP by more than 10 mm of Hg. You can see in this example. Group asthma, COPD, and cardiac tamponade. Remember, this is waterma, this is the air in plural, this is the air in the plural space. Nemo means what? Nemo means air. Nemo means air, nara. Thorax, air in thorax. Okay, now see here you can see that there is any trachea deviation, no? Trachea deviation, nothing. See, this is a deep. There is a deep sulcus sign. See, trachea shift. See, but see, this is pneumothorax. But in the intense pneumothorax, guys, the trachea will go into shift. Okay, there is a what? There is a deep sulcus sign in C. Sulcus. See here. How is this here? Here we can see this one. There is a deep sulcus. Okay, see this here. The thickness here. We can clearly see the margins are like this. This is called as deep sulcus sign. Okay, Nara. For treatment, you have to give the O2, oxygen, and aspiration. You have to aspirate because there is a waterma, there is a more CO2. Okay, so have to do the chest tube placement and a one-way valve. That's it. Next one, remember this one. What is the most common organ injury in the blunt abdominal trauma? It is the spleen. Most common organ injury in a penetrating trauma is the liver. Most common injury in bomb blast. If they ask the structure in what is the eardrum. If they ask the organ is the lung. Most common type of skull fracture, Linus fissure. Injury in seat belt syndrome is the mesentery, that is the, and next is the hollow viscous intestine. Most common injury in the underwater blast is the intestinal barotrauma. Remember here, guys, this is the omphalosil and this is the gastroschisis. How we are going to remember it from Om follow seal, Om follow seal, sealed. Om follow sealed means what? Packed. See, all the herniated structures are packed, are sealed with the what? Sac, covered with the sac. What the content? See, Om follow there is double L, liver, liver and the intestinal content. Remember this one, the gastroschisis, gas leak. See, this is all the herniated structures are leak outside. They're not covered with the sac here. Okay, so that's why see, ski, C, E, D, I. It means intestine only. It is the content. Okay, done. Remember here, this is the shock. See, first of all, you have to remember the blood. This is the class 1, class 2, class 3, class 4. You have to remember the blood loss. 15%, 15 to 30. See, if there is a less than 15%, 15 to less than 15%, 15 to 30, 30 to 40, less than 50%, less than 50. Class 1, remember, class 1, less than 50%, class 2, 15 to 30, 15 to 30, 30 to 40, more than 40, 15, 15 to 30, 30 to 40, more than 40 is the class 4. Okay, remember the percentage because in the exam, guys, in the question they are going to give they will just there is a blood loss of only 30%. Then it will come to what class it is, the class 2. Remember, guys, this is the like this one, guys. Suppose example in the first class. Suppose example in the first class, guys. Suppose example, I just got hit by this this wall. Okay, there is just a few blood loss only. Okay, now there is few just 1 ml, 1 ml blood loss only. So the my BP will be normal. Okay, na? I'm not going in the unconscious state. So this is going to be the class 1. That's why there is a what we need to do the give the fluids only. No need fluid, just drink the water. Okay, that will more than enough. Okay, so how they are going to ask the question, guys? See here, they will ask you guys from which class, onwards the BP is going to down. Class 3 only. Until class 2, the BP is normal. And from the class 3, the BP is going to down. That's the question they're going to ask. Okay. That next they're going to ask you in which class there is the patient will be confused and lethargic. It is a class 4. Like this question they're going to ask, guys. Okay. Done. Remember this one, guys. This is the infective endocarditis. Just follow me how they are going to ask the questions. I'll just tell you. First of all, they will ask you, what is the most common bacteria? It is the Staph aureus. Staph aureus. Staph aureus. Remember. Okay. What is the most common valve? Mitral valve. Okay. Most common valve is a mitral valve. Okay. Is that tricapsule valve is associated with the injection. Okay. Now see. Remember here. If it was wait long. Suppose example, guys. In the micro, okay, na? In the micro, guys, they will give this one. Suppose example, a patient got the endocarditis, and there is a infection by what? There is a prosthetic valve. If the infection is by the prosthetic valve, then which organism is called by? It is S. epidermidis. S. epidermidis. Suppose they will clearly mention you guys if there is if endocarditis is called by the prosthetic valve, then it is the what? Bacteria epidermidis. Okay, now. Okay, na? If it was caused by the injection to the drug, like IV drug, caused by the IV drug user, then it is caused by the Staff RS, or else it is staff what? Epidermidis. If it was by injection or I said IV drug, then it is called by the staff RS or Pseudomonas candida. Okay, na? Remember here. This is too important. See how see normally this is the what meterval is common. What if they will take if it was the battery transfer by from the injection, then it will also involve the tricapsid. Okay, that's it. That's the question they're going to ask from this one. And if okay, na remember guys, there is a modified Duke criteria. Okay, na modified Duke criteria. There is a major and minor. Last exam question they ask this one: blood culture positive more than 2 times 12 hours apart. More than 2 times 12 hours apart. And there is a endocardial involvement showing valvular. There is a valvular vegetation. It's a large destructive vegetation here. Splinter hemorrhage here. Postner's node here. Rough spots here. See, these are the questions they are going to ask in the exam. See, what is the major criteria is the blood culture positive more than 2 times apart, more than 2 times 12 hours apart. Most common bacteria are yes, valve, mitral valve, prosthetic valve. It is the staph epidermidis. Injection staph aureus. That's it. Okay. Next one. Next one. See, this is the rheumatic fever. Rheumatic fever. Okay. First of all, remember it is caused by gas. Okay. Group A, Streptococcus. It causes what type of necrosis? Febrile necrosis. It is a type 2 hypersensitivity reaction. Okay, now type 2 sensitivity reaction. Okay, now see here. Please watch this one. See here, there is a criteria called as revised Jones criteria. Okay, revised Jones criteria. There are two major and one minor for the diagnosis. See right here how you are going to remember the major and minor. See here. See, this is the major one. This is we have in the joints. That is the what they call as the migratory polyarthritis, carditis. And there is a nodules. Nodules subcutaneous. This is the most popular one. Most commonly causing the nodules, that is subcutaneous nodule. There is erythema marginatum and a synhernus chorea. Patient will have dance. Coming to the minor rasi here, minor category fever, increase PR, CR, SR, R, C, R. See, it's easy. It's a minor. This is the minor criteria. This is the minor criteria. All are fever, PR, CR, ESR, Arthur, all are. This is minor criteria. Done. Remember how do you are going to manage that one? Suppose example, see for the rheumatic fever, see if the patient is having rheumatic fever without carditis, rheumatic fever without carditis, the duration of prophylaxis is for 5 years after the last attack or until the 21 years you have to give the prophylaxis. Remember here, rheumatic fever with carditis, but there is no residual valvular disease. Rheumatic fever without carditis, 5 years. Rheumatic fever with carditis, but no valvular disease. Then it is up to for 10 years after the last attack until the 20 for 10 years. Remember here, rheumatic fever with the persistent valvular disease evident clinically on echo. See, rheumatic fever, no carditis, 5 years. Rheumatic fever with the carditis, this is 10 years. Rheumatic fever with persistent valvular disease, then you have to go for the 10 years after the last attack and until what, 40 years of age you have to give the prophylaxis. Here the 21 years only. See, the question asked this one, see here, there is no carditis. Then what, this is the what answer is the no carditis. That is 5 years. Okay? Done. This is how you have to mark the answers. Okay? This is the ask of body. We'll see in the we'll see in the what here. Ask of bodies in the rheumatic fever. Okay, done. This is the, I think everyone knows about this one. This is what amma snowflake cataracts in diabetes due to sorbital accumulation. This is Roger cataract seen in the blunt. This is Roja, Puva. Okay, blunt trauma, sunflower. This is seen in the cuts in Wilson disease and the penetrating trauma. Just remember by heart. This is the Christmas tree cataract, myotonic dystrophy, seal cataracts in the atopic dermatitis, blue dot, most common in congenitally insignificant. That is the what this is the blue dot cataract. Okay, then next see this one. This is the types of keratitis. Types of keratitis very important. This is what this is like a net like. This is like a net like net like. This is caused by human central virus. They will give the history. There is a reduced corneal. There is a reduced corneal sensation, and we have the terminal bulb. What pattern? There is a arborizing pattern. Okay, na? Arborizing pattern. This is the pattern. This is what This is the bacterial. See, this is the bacterial. There is ulcer bacterial. The most common in India it is the pneumococcus old staph aureus. This is a green ulcer. This is a bacteria are green ulcer. Wet infiltrate ulcer margin defines hypopian. Is remember here hypopian is what sterile here. For this one, guys, this is the fungal infection. The most common is the water candida. See here, they will give the history as the farmer. The farmer got the trauma by very thorn, like a thorn of the leaves, something. Okay, they'll give history. But this guy, there is a satellite. There is a satellite lesion here. There is a satellite lesion. There is a ill-defined. There is no defined margin, and this is a non-sterile. Okay, now this is the fungal infection. Treatment with the 5% natamycin. This is what acanthamoeba. There is a ring like this is a ring shaped ulcer. This is acanthamoeba. Okay, like this one. Next one, this is the types of okay. Next one is the okay. Last two types of graft. See, autograft, allograft, genome means graft, isograft. See, autograft means what? Tissue transfer within the same body. मेरे body को मेरे पे काट दिया, ठीक है? Auto means self. I okay ना self. Skin यहाँ पर डालो skin. Self. Allograft means organ or tissue transfer between genetically different the same species. Okay, it's like my mother's like me. My mother's skin graft to here. Allograft. Genome means what? GC. What is genophobia? Fear of passenger. That's the this is transplantation between the different species. Example, pig heart walls in human. Okay. Isograft, organ transplanted between the genetically identical twins. Twins means what is the isograft? Okay, na? Are you getting? Next one, rejections. Hyperacute rejection, acute rejection, and chronic rejection. Okay, na? Hyperacute means what? Occurs within the minute to hours. Acute rejection occur within the days to weeks. Chronic rejections occur within months to years. Let's remember this. Okay. Next, in one of the examination, they asked that which of the following organ is having the highest rate of rejection. This line I was taken from the Swaj surgery. The same line. They told that intestine transplant having the highest rate of the rejection. Okay. Done. This is the textbook line. Next, remember here, last one is the snake bite. Okay. So, for example, this is a case. A patient is brought to the causality with a history of snake bite with features as shown. During the course of treatment, the patient expires. The accused snake is brought to the by the so okay. This is the pamu. This is the सांप है, ठीक है? We having the white bands. Yeah, white bands. Okay, having the white bands. What it means? See here, we having the total 3 types of snakes. neurotoxic, hemotoxic, and the myotoxic. But these two are very important. Series and neurotoxic. We have the total two snakes. It is the cobra and a kite. Cobra and a kite. See, cobra having the specs. Okay, having the specs. Okay, na? The specs they having the hood also. Is the hood specs cobra. Okay, all kings normal people can wear specs something there is a mnemonic but kings never wear specs. Okay, this is correct. Having what there is a white, there is a white bands, they are the neurotoxics. Remember what is the cause of death in the neurotoxic? There is the respiratory paralysis or arrest. Come to the hematotoxic. Remember see, hematotoxic means what hematotoxic means in the vessels now or vessels. Hematoma means what vessels only na, blood vessels we viper 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 means what vessels like this one. Remember the hematotoxicity or vascular toxicity. V for viper, V for vessels. Hematotoxicity. Okay, there is a watama, there is a diamond spot, there is a diamond spots here. There is a diamond spots on the body here. Okay, what the most common cause of death is a renal failure or bleeding. Okay, now, obviously, when it is hemerotoxicity, then obviously there is going to be bleeding. This is the myotoxic. That is the T snakes are myotoxic. These are not more serious cases. Okay, remember. So how we are going to manage the snake bite here? So for the snake bite, guys, how to clean with the water, immobilize the limb, wrap a bandage, not to tie, do not tie too much. Okay, na? Apply the basic first aid, wash with the wound, soap and tap water. Do not do the tourniquet, tie tourniquet, do not cut the wound and remove, do not suck, okay, do not tie ligature around the wound, do not apply any herbal paste or the over the wound. Drugs, you have to use the poly, anti-snake venom, atropine, and neostigmine. Depends on the severity. Assurance, wound dressing and IV fluids, anti-venom, antibiotic, tetanus vaccine, and the blood transfusion, the management. Okay. Thank you very much, guys. So I'll see you in the next session. Thank you very much.